Welcome, everyone, to another episode of Inside Lyme podcast with your host, Dr. Daniel Cameron. In tonight's episode, Dr. Cameron will be discussing the first in a series of 4 podcasts, which will focus on findings from his recently launched Lyme disease and COVID survey. In the first podcast, in this first episode, we'll be discussing the burden of Lyme disease in a COVID-19 pandemic. Good evening, Dr. Cameron. Thank you for joining us.
And good evening, Darlene, for joining me and leading the discussion.
So can you talk just this first episode? You're gonna talk a little bit about several cases and their findings from the survey.
Yes, I was trying to avoid discussing the research design. That it's a survey design that cross-sectional. I wanted to get right down to cases. Now, because this is a research study, it's approved by an IRB, it lets me present individual cases that are living in a pandemic. So I wanted to start out with this case that comes from the survey, because the survey actually has at this time 1,168 people who've had a history of Lyme who've completed this survey. So this case 1 came from that survey, and it involved a 68-year-old woman with history of deer tick, no rash, but they did have a clinical presentations. They weren't completely sure what test was positive, and like you hear all the time in medicine, some people are ill for years. She had been sick for 9 years, treated with a broad range of antibiotics and supplements for 7 of those years. So she was chronically ill when she filled out the survey. And they were all the typical symptoms like backache, stiff and painful neck, muscle aches, and so forth. And she had done like a questionnaire, which has to do with this level of symptoms she has. This is where you add up how sick you are from neurologic issues, neuropsych issues, pain, fatigue, and so she had 78 as a score out of 120. Some people have 0, some have 120, but still 78 shows how sick she was. In fact, she was sicker than this study by Fallon, sicker than traumatic brain injury patients, and sicker than somebody with post-treatment Lyme disease syndrome in their study, and worse than depression patients. So it just shows you that this 68-year-old woman shows up with so many symptoms, so many chronic issues, and she's facing the challenge of what to do during a pandemic. She hasn't taken the vaccine, she never had COVID, but she filled out the survey describing how ill she was. And none of these symptoms are a surprise. One more thing I thought I'd mention is that when she's living with all of these symptoms and she is facing what to do with a pandemic, I'm sure she's worried and concerned about what will happen if I get COVID. And I'm going to be addressing what happens when a Lyme patient, or at least someone with a history of Lyme, gets COVID. And she's wondering, should I listen to the doctor? Because the doctor said, it'll probably make things worse. So she's not taking the vaccine when she filled out the survey. But it does show that someone this sick at 68 is still perplexed. What if I get COVID? And what if I take the vaccine? And this survey, especially the second, third, and fourth part of the survey, explores what actually happens when people with history of Lyme disease take the vaccine, or if they contract Lyme disease. It's great that these 1,100 and some individuals shared their experience, so we can learn from what each of them went through.
And now you're also writing about, you had some children who were participated in this survey as well.
Yeah, the age range was 12 to all the way up in age. So a 13-year-old presented. Now, I mentioned 13 because they have to be at least 12. I certainly could use a lot more kids from 12 up to describe better the experience that kids have with Lyme, also kids with Lyme and COVID and with the vaccine. So this one filled out the survey with the parental consent. And this girl had a Western blot test with 5 out of 10 bands, and you needed a 5 out of 10 to make the CDC criteria. And she'd been sick for 2 months. And then they gave her 3 months of doxycycline, followed by clarithromycin. So she still was chronically sick from her perspective in the survey, but this GSQ, this score of symptom score was 0. So even though she didn't seem to have a burden of symptoms, she still reported feeling chronically ill. And once again, I'm sure she's facing, should I take the vaccine? Her mother and father are probably also concerned, but I'm sure they're concerned about if she gets COVID. So here's what she said in her notes. She's has really not been advised for or against the vaccine. Now, you remember she's a 13-year-old. So being 13 means that she's has to work with a parent and about, should I take the vaccine? Mm-hmm. But she said, I do not feel safe to take it since my Lyme conditions are still not resolved. So when you get to the 4th part of this series, I'm going to be doing a lot more descriptive work on the various reasons that people are reluctant to take the vaccine, adults and kids.
Now, one of your cases involves a 85-year-old man with a history of tick bite and rashes and a swollen knee. Can you talk to us a little bit about that case as well?
Oh, thank you. But this 85-year-old man, he's not sure what tests were positive, but he was treated with doxycycline and supplements. But he was ill for at least 3 years. At the time of the survey, he was not chronically ill, but he's 85 with back pain, muscle weakness, fatigue, low energy, worse after physical activity, numbness, tingling, skin and muscle twitching, balance problems, room spinning, visual issues, trouble focusing, bladder discomfort, change in urination, lightheadedness, uncomfortable standing, trouble finding words, retrieving words, trouble with memory, and lower speed of thinking. Now, when you go through that list and you're 85, is that it's so exhaustive that it's going to take several specialists to weigh in, like, are there any urologic issues because of the bladder discomfort? Are there any neurologic issues because of the lightheadedness and problems standing? Are there any cognitive issues with this presentation? But Lyme disease certainly does the whole range of symptoms that this 85-year-old was discussing. And once again, his score was 78 out of 120. So even though he had been in a pandemic, he hadn't taken the vaccine yet, he hadn't had COVID, but even before getting COVID or taking the vaccine, he already had a high symptom burden. And 78 is worse than somebody with somebody who has post-treatment Lyme disease syndrome or traumatic brain injury. And so I can imagine having problems, because I have patients like this, the difficulty which what happens if I get COVID and I have a chronic illness, or what happens if I take the what happens if I take the COVID vaccine? So it shows you that, as I mentioned earlier, there's a 13-year-old facing the same issues. Now this is an 85-year-old. It reminds us that all ages face the same challenges.
And you had, you had several cases that you highlighted as well with patients who had Lyme disease but did not take antibiotics.
My concern is, and with these cases is that you always assume that someone with Lyme has been treated. But this survey highlighted that there are people out there who have a history of Lyme, history of tick bites, history of rash, swollen knees, positive tests like the 77-year-old woman, but they didn't get treated with an antibiotic. Now, this 77-year-old was ill for 10 years at the time of the survey, and someone had also diagnosed her with chronic fatigue. She took supplements, but never antibiotics. Now, her GSQ score was 14 out of 120, so she's not near as sick as some of the other Lyme patients. So that may be why she didn't jump in the treatment, but you never know. I have patients in my practice where they go the route of supplements, and they get enough value that they don't actually get treated. But still, even if this 77-year-old woman doesn't get treated with an antibiotic, they still have to face the same issues with what happens if I get COVID, and what if I take the COVID vaccine? And lastly, this is another young survey participant. She's 16. She had a swollen, thought she was exposed because she's in recreation, with the recreation vacation, interaction with dogs and hiking. She had a positive test, but she was also diagnosed with chronic fatigue. She was sick for 3 years, but she had herbal treatments and not antibiotics. So nobody said really take the vaccine or not take the vaccine. So I'm sure her parents are probably facing those same issues, as they look out for their 16-year-old. But what's interesting is this score, which I find from 0 to 120, there's a range, but she had 88. So that means she had severe neurologic, neuropsych issues and fatigue and pain. And there's a whole list of problems that are what you should expect: this neurologic, neuropsych, and fatigue. And so, even a 16-year-old hasn't been treated. So you wonder what will happen with her if she gets COVID or take the vaccine. And so these, I guess it's 289 individuals who fill out the survey who had not had COVID, not taken the vaccine, but yet I'm sure they're wondering what to do during this pandemic. And plus they're suffering anyway. It does reflect that when I look at how bad somebody is and how sick they are with Lyme and COVID, I'm reminded that just Lyme itself, they can be quite sick.
So as you highlight, these cases demonstrate the symptom burden in these individuals was quite severe. Now you talk a little bit about in your blog about an NIH study. Do you want to discuss the findings from that and how that relates?
Well, the NIH study had confirmed that using a quality of life survey, SF-36, that people were sicker than someone who filled out the forms who had diabetes, and as bad as people with congestive heart failure. Now, in that case, even though it showed that people with Lyme could be so sick and quite sick, this is looking at it more than just the quality of life. This GSQ score is looking at the issue of neuropsych, neurologic, and pain and fatigue issues. And it shows that, yes, they're sick from not just the quality of life, their perception of life, but they're quite sick on issues that are important to all of us.
So what would you like the individuals to take away from this this first set of findings, these cases?
Well, it's rather interesting that that we're dwelling in the second, third, and fourth part of this series on how sick people who are with Lyme and COVID. or how sick they are with the vaccine. But the headline is that people with Lyme are so sick and can be quite sick at least. And when I keep saying GSQ, that's called the General Symptom Questionnaire with 30 questions about your health. It sort of sets the stage. So if I do statistics down the road, I'm sure I'll find the dominant issue is that Lyme disease is the issue for these patients, and the illness is from the Lyme, and there might be extra on top of their illness with the COVID or with the vaccine. But you have to stay tuned, because I'm going to dig deep into what happens with Lyme disease individuals when they do get COVID. And it's fascinating, both how sick they are. And they're not really well, but the vaccine actually isn't. They weren't as sick as I thought. Some of them had a flare up, but I'm going to dig into the weeds and really explore these topics.
So the next episode, you'll be discussing Lyme disease patients who had COVID and the vaccine, or just COVID?
That is, part 2 is Lyme with people who contract COVID. You know, what happens to that group? Because there was almost 300 people, or at least that had COVID on top of their Lyme. So it's fascinating to look at what happened. You know, 20% of those ended up with long haul. So if you already have Lyme already, and 20% of those with COVID got long hauler, you're dealing with this issue of like, how do you know the difference between Lyme and COVID? And so this kind of research gets in the weeds and really tries to understand the role of Lyme and its potential role in somebody with a long haul illness.
Well, we look forward to the next episode and hearing a bit more about those other findings. This is kind of a one of a kind survey, right? It hasn't been done by anybody else.
Yeah, there hasn't been a survey of Lyme disease patients. Most of these studies, they exclude people who are ill. Even the vaccine studies exclude people who are ill. So this is the largest study by far of a clinically applicable experience on Lyme in a pandemic. LymeDisease.org did one on earlier on using their database, which was helpful. But this one gets right into the details of what's happening to individuals and who have Lyme and COVID and Lyme and the vaccine. And so I'm excited about this study. I can publish and in journals, but I didn't really want to wait for journals and have that as my only outlet. I wanted to dig in to these cases and present them through the blogs, through this video series. And lastly, not only would I like to share these 4 videos, but I'm strongly encouraging the readers and the listeners to fill out their comments and thoughts. So I'll be following up with a Q&A, a separate video to address as many concerns as I can. So not only are these 4 videos, but there'll be at least a couple Q&A based on your comments.
Well, thank you, Dr. Cameron, for sharing these findings, and we look forward to joining you again to learn more about some of the other findings. And for individuals who'd like to read more about these cases in particular, they can go to your website at danielcameronmd.com. Thank you, Dr. Cameron.
And thank you, Darlene.